Hello, and welcome to the Healthy Lifestyles for All presentation. My name is Cassidy Harris, and I'm here to walk you through our program. So, a little bit about our program. It aims to reduce obesity in Campbell County's adult population by conducting education interventions, broadening access, and partnering with several organizations and professionals. All of this is basically to support the community with efforts that will empower residents to live and lead healthier lives for the upcoming generations. So, obesity affects millions of people nationwide, but rural and lower income households are more vulnerable because of the systematic barriers. Also, here you can see that obesity in Campbell County exceeds both the state rate of Virginia at 35% and the national average of the United States at 41.9%. So, here with our priority population of low income adults ages 18 through 64 that face several barriers in the community, such as limited transportation, lack of health education, limited access to affordable nutrient foods, and adequate physical activity facilities as well. And all of these refrain them from living healthy lifestyles. So, our mission here is to focus on the empowerment through accessible resources and education to improve nutritional habits and physical activity in Campbell County's adult population. These are just a few of our SMART objectives, and they will guide and impact goals to ensure accountability in the implementation of our program, such as having one community garden in Cable County by May 2029. That'll help it produce fresh produce to the community members and allow um, them to learn more about fruits, and also then it can implement certain recipes as well. So again, these are just a few of the SMART objectives um, listed here. So for our planning model in theory, we would be using the precede proceed model and the social cognitive theory. The precede proceed ensures we assess and evaluate accurately, and then the social cognitive theory helps influence behavior through confidence and support. And then overall, just being able to provide our community with peer support, self advocacy, and role modeling. Now, for our interventions related to the nutrition side of our program, this will be focusing mainly on improving food access through education and local resources, and that will then reduce the barrier and help build long term habits. Again, of the example from earlier with the community garden, another one that we would like to be doing is the partnership with local markets and grocery stores to provide, say, grocery vouchers for them, or if they donate like produce, um, depending on the partnership with a certain grocery store or market. Then, with our interventions for physical activity, um, we are trying to get physical activity to become accessible when it becomes accessible when it's free, fun, and social. So healthy lifestyles, we want to make these happen all throughout the community, and this may be something like giving a free exercise class in a park nearby with the use of a local professional or trainer, stuff like that, and just hosting health wellness events, and then having different models and resources for sharing other physical activities as well. So when it comes to our resources, there's a lot to cover here. But basically, we're using a variety of physical resources to keep the program sustainable and adjustable as possible. So here on the slide, you can kind of see that for personnel, we have managers, educators, all the way to volunteers and local professionals, different outreach specialists. Those are very important. And then with the curriculum, because there's a variety that we have going on, There will be educational materials, there'll be meal plans, fitness programs, um, as well as different things like flyers, brochures to help with promotion of our program. And then we'll be using a variety of spaces. Like I mentioned, parks. We could do local churches. We could use YMCA's or schools, whatever is best and most local, or again, a variety for different areas in Campbell County to be able to reach multiple areas of the community. Um, Even having like the mobile units that will be for conducting nutrition classes and informational programs. And all this will be funding based off of, we'll probably be funding the staff salaries, potentially having stipends for volunteers. We'll be having grants, different advertising, marketing, a whole bunch of stuff for that, the resources. And then our estimated budget here is kind of listed out. Now, again, this is all estimated because it really just depends on how many people we have on, how many stakeholders are getting involved. So it all just really varies here. But essentially, a diverse funding here helps to keep programs sustainable and adjustable. Um, and so this is just a high level breakdown. And here we can clearly see at the top that our personnel is our largest investment. And then after that is um, the indirect admin stuff, and then going down to facility and equipment, and then all this is estimated. Some of this might be donation based, some of them might be, having to rent out. It just all depends and what's available to us and what partnerships essentially for our stakeholders. So then with this, our implementation timeline kind of goes over and spans about 5 years. This ensures to give time for action and improvement as well. So here you see year one, we're going to be developing everything, securing things, and creating the materials. Year two, we would love to get stuff implemented. And then by year three to five, kind of scale up our interventions, maybe expand a little bit, and get some good comprehensive evaluations in there as well. So, with our policies, we are going to be advocating for supportive policies that are going to align with our goals and will benefit the entire community. So, the individual levels that may look like tax credits for gym memberships or food vouchers. Community level, this may look like getting zoning policies done for farmers market or community garden, or getting more walking trails and public fitness facilities that are more accessible to the community. Now, for our stakeholders here, each stakeholder is a vital role in leading our Healthy Lifestyles for All program in order for it to succeed. So here, collaboration really is key. Funders will help support organizations may host, also partnership with us and promote the program. Personnel, they will be assisting in running the program to deliver information, and then certain officials that will be some of our stakeholders there might be the ones advocating for the policy changes to happen for us. Then some of our benefits overall, if you don't realize this already, but everything's very convenient. Get things convenient for physical activity, for nutrition, local food sources, community engagement. Um, Overall, we just want healthier individuals because they will create a healthier community, and the benefits will spread over and create a long lasting healthy environment for our population. Our marketing things with this, we kind of like to say healthy lifestyles for all is your path to wellness. And essentially, that when it comes to talking to our community, that their health matters to us, and together we can all build healthier Campbell County. We'll be using these strategies and stuff like that all throughout different channels like social media, radio ads, newspaper articles, different community events, whatever works best for that community at the time or what we receive best feedback from. And certain incentives with that, trying to get people in, giving free resources with, say, maybe free fitness gear, produce vouchers to get them coming in our door. All of this is made to create a community that trusts us through these channels and then also be able to reach them to the ones who need it the most. So things to consider with efficacy is HIPAA compliance, cultural competency, and equity. Now, Healthy Lifestyles for All is committed to upholding ethical standards all throughout the program implementation. This will look like having our staff and volunteers receiving training on ethics, cultural sensitivity, and confidentiality to maintain trust and inclusiveness with the population. Overall, we want you to join us. We want you to help either support us on our journey as we go into Campbell County to fight obesity here, and or we might be asking you to partner with us. Whether you this might look like you becoming a staff member, getting volunteering with us, or if you're an organization, partnering with us. But we would also like to go a little bit step bigger and also replicate this program in other areas, whether that's surrounding communities, surrounding towns, or in different states as well. So, however that may look, we are just asking you to join us in this and fight obesity overall. And then here are just my references from throughout this presentation. So thank you for joining me. I hope you consider joining us and our Act 2 ending obesity here. Thank you.